Okay, my name is Calvin Mendoza. I'm a student at the Summer City College Radiology program. I'll be demonstrating my skull trigger. I'll be demonstrating 4 positions. First of all, lateral skull, PA axial Caldwell method, AP axial Towns method, and an SMB. Okay. First thing I'm gonna do is get my room set up. So I'm gonna go on wall bucky. Okay. Okay, that's my wall bucky. And this room only detents to 48 inches, okay? So I'm gonna angle it. Okay. Make sure this is gonna be lined up to my bucky. This is where I'll be doing all of my positioning. And I have some shielding. For my positions, okay? And skull, I like to have a chair ready because it'll help me out with my projections, okay? So now that I'm introduced and I have my thing ready, I'm gonna go get my patient, okay? Santino? Hey, sir. How you doing? My name is Calvin, one of the X-ray techs here. I'll be doing your X-ray today, okay?
Yeah.
What's your first and last name?
Santino Rodriguez.
Okay, your date of birth?
4/21/84.
Okay, sir. So, if there's a guy, I'd ask if there's pregnancy. Any chance you might be pregnant?
No.
Okay. So, what brings you in today, Santino?
I fell and I hit the side of my head.
Oh, around where?
Right here.
And this happened today, or when did it happen?
Yesterday.
Okay. Any other history with your school?
No.
Surgeries? This is the first time your concussions?
No. Yeah.
Nothing.
No, nothing. No.
Okay. So, so we're going to be doing a few extras. Okay, Santino?
Okay.
Do you have any dentures?
No.
No. You don't have any earrings? I will need the glasses off. Okay.
Sure.
So in a minute, I'll ask you to take off your glasses. Okay.
Okay.
Any questions before we start?
No.
No?
Nothing.
Everyone's good? Okay,
Yeah.
so I'll take your glasses and go ahead and face that way on the bucket.
Okay.
Okay, and then we'll be getting started with you in a minute, okay?
Okay.
Okay, so now my rubber is set, patient's ready. I'm putting my first image. I'm going to do the lateral projection. IR clockwise. Okay, so eyes like crosswise. I'm not happy rotate, okay, ma'am? Go ahead and bring this on out. And I want you as close to the IR. So we want her face touching the IR. 3 things for our lateral. First of all, we want the mid-sagittal plane parallel with the IR. Right there. Okay. And then we want that interpupillary line perpendicular to the IR. Open your eyes, man. Perfect. So we have 2 interpupillary line perpendicular and the mid-sagittal plane parallel to the IR. Third one is going to be the IOML. It's going to be perpendicular to the front edge of the IR, okay? So, IOML. Right there. She'll tilt it back, so I'm going to rotate her a little bit again. Okay? Right there, man. Don't move, okay? And then the central ray is going to be 2 inches above the EIM. So EIM's right here. You're probably in the center about right here, okay? 2 inches. And I'm going to move you a little forward. Okay, I'm just check that there's no rotation. Seems to be good. Now. Okay. Lastly, don't move now, okay? Okay, so we're ready for the lateral skull, okay? And we see some light up here. I'm gonna call in it a little. Okay, and I'm going to place my right marker, so it's the right lateral. Place it over here. Okay, technique wise 80, anywhere from 5 to 8 mass for the lateral, okay? Alright, ma'am. Hold your breath. X-ray. Okay, so that's the first one. Okay, so then I go read my cassette and okay. Okay, so now I'm back with a fresh cassette. For this one, I'm gonna ask the patient to have a seat. We're gonna have a seat. This time I'm gonna go in lengthwise, okay? So IR is lengthwise. Can I go ahead and scoot over forward? I'm gonna bring my bucky down. Okay. Okay, so now I'm gonna place the tip of her chin and her forehead against the IR. Okay, so now place that right there. Perfect. And for this one, I'll make sure that the OML is perpendicular to the IR. OML, okay? So, OML. Go ahead and bring your chin down a little bit. Little up. Okay, so now that we have the OML perpendicular, cover her nose and chin, and we'll bring down the bucky. What I like to do is I like to put this line right here at the nasion. Okay, so this line right here is at the nasion, okay? Lastly, I'm gonna give it a 15-degree angle caudal, okay? And I'll match my line, central ray, 15-degree angle caudal, and it's in the nasion, okay? So I'm just gonna give it a 15-degree angle too, and then match this line, and we should be okay. And then the mid-sagittal plane. Okay. This time there's some artifacts in the school. So I'm gonna do is make sure that the mid-sagittal plane is right there. And check again for another rotation. Okay, perfect. Right there. Okay. And that should be it, okay? 15-degree angle, X in the nasion. Technique wise, I'd probably go anywhere from 80 to 85 kVp at 10 to 14 mass. Probably 10 on someone on her small head. Okay? And there's a light above. I'm going to place my right marker on there. And probably column it just a little bit. Okay? Give her some lead shield. Hold it now. Okay? And ready to. Okay, so hold your breath, ma'am. X-ray. Breathe. Breathe normally. Okay, so now that we did the P-axis, now we're going to do an AP-axis. So I have moved my patient to a chair, and she's AP, okay? So we're going to place a 10 by 12 lengthwise. And we're going to try to direct the central ray through the foramen magnum at a 30-degree angle. And we want the OML perpendicular to the IR. This is a 30. You can do a 37, which would be IOML, but I'm going to do a 30 through the OML. Okay, ma'am? So give me a second here. Okay, so I got a 30-degree angle. Center from the sagittal plane first. Okay, so mid-sagittal plane. So I'm going to give her some lead shield. Try to protect her breast. Okay, and Ma'am, so I want your head, the back of your head, the IR, and bring your chin down as much as you can. So we want to keep her head against the IR. Do that bring down your chin? Okay? Central raise you need 2.5 inches above the glabella, okay? So go ahead and bring you down your chin. A little more. And we want the OML perpendicular. So the OML right here. Just go ahead and put down a little bit more now. Perfect. So that way right there, the OML perpendicular to the AM and into the R. Perfect. Okay. Try not to move, okay, ma'am? She moves a little bit. Alright, so try not to move. Gonna match. Going to make sure this is light about this bolt, it's getting projected. Consolidate a little in. And place my left marker up over here. Okay, so 30-degree angle, OML perpendicular, center is 2.5 inches above the glabella, and passing to the level of the EM. Okay, I probably use anywhere between 80 and 85 at like 12 to 16 mass. Okay, all right, now don't move. Hold your breath. X-ray and breathe. Okay, man. So let me run that film. Okay, so for my last projection, I'm going to do my SMB projection. We can do a 10 by 12 lengthwise. Okay. So this one I'm going to move the chair a little forward. Go ahead and lean to your butt forward now. Okay. And back. Okay. And tilt your head a little bit. I'm going to move you a little bit, okay? Okay, relax. So I just did that to see where I'm at, okay? And my central rays can be directed through the solid turcica, mid-sagittal plane, and in between the angles of the mandible. Okay? And we want the IOML perpendicular, okay? So we'll go ahead and do that. Go ahead. Alright, so we want mid-sagittal plane. So move it. A little rotated. We're going to mid-sagittal plane to the solid turcica. We're actually going to go a little bit down. And we want the IOML. So go ahead and put your head back a little more. Okay, perfect. IOML. Okay. Like I said, central ray directed to the solid turcica, mid-sagittal plane to the mid-sagittal plane in between the angles of the mandible, and 3/4 of an inch anterior to the level of the EAM, which is right there, okay? Anterior. Alright. Put some net shield. Not too bad. Okay. I'm going to play my left marker. Okay. And my technique for this will be anywhere between 80-85 at 25 to 32 mass. Just been going through the most dense part of the skull and the longest, okay? Okay, ma'am, don't move. a little bit in. Okay, looks good. Alright, so hold your breath, x-ray, and relax, man. Let me help you out here. Relax, okay? So I'm going to go ahead and read this last image, ma'am. Give me a second. Okay, ma'am, so we're all done. The x-rays, so I'll send the images out to the doctor. They'll see if there's anything wrong, and then he'll let you know within 24 to 48 hours, okay?
Okay.
Have a good day. Hope you feel better.
Thank you.
For images evaluations, we have the lateral skull, and we want to see the whole skull in profile without any rotation or tilt. And that is demonstrated by the thoracica. And also the orbital roofs should be superimposed. Superimposition of the TMJs. And also the master regions and the EAM superimposed. And it should be good penetration to see the whole skull in profile. And we don't want any overlap of the cervical spine by the mandible, so we want this space right here. Okay, so we move on now to the Caldwell method. And we do this in PA axial. We want the whole entire cranium without rotational tilt. We want equal distances from the lateral borders of the skull on both sides. And we want symmetric petrous ridges, so down right here. And we also want the sagittal plane of the cranium along line with the long axis. And we want the petrous pyramids lying in the lower third of the orbit, so down here. And we want to see the squamous bones around here as well, okay? That is the Caldwell method, and we use it to check for the frontal bone. Now we move on to the AP axial, which is the Town method. The Town method, we want the whole cranium without rotation or tilt. And that is demonstrated by equal distances from the lateral borders of the skull to the lateral margins of the foramen magnum down here. Symmetric petrous ridges, these ones right here coming down, and the mid-sagittal plane of the cranium aligned with the long axis of the collimated field. We want our dorsum cellar and the posterior clinoid process visible within the foramen magnum. So we want this to show down here within the foramen magnum. And we want a good penetration of the occipital bone with appropriate brightness. So as you can see, we can see the whole entire cranium. This is the Town method. Lastly, we have an SMV view, which we should be able to see the entire cranium without tilt or rotation, and we can see that because of the equal distances from the lateral borders of the skull to the mandibular condyles right here. Symmetric petrous, and the IOML should be parallel to the IR. And it's demonstrated by the mental protuberance superimposed over anterior frontal bone, to the frontal bone, and the mandibular condyles down over here, anterior to the petrous. And we want to see the good brightness and overall contrast of the cranial base anatomy. So as you see, this is a pretty good image. That's what we want to see in an SMV. And that does it for the evaluations of the images.